Benefits and Insurance Committee meeting to order. Susan, call the roll, please.
Commissioner Boyd. Here. Amber Brown. Here. Mike Curtis.
Here.
Holly Deering. Here. Brian Gaither. Here. Mary Hickerson. Here. Lois Miller. Here. Commissioner McAdoo. Here. Commissioner Phillips. Jennifer Schmidt. Here. Michael Smith. Steve Spence. Sonia Stevenson. Here. Eric Tutobeni.
Thank you. Madam Vice Chair, have you had an opportunity to review the minutes of the previous meeting, which I believe was 2 months ago?
Yes, sir. Yes, sir, I have, and I motion to approve as presented December 19th.
We have a motion to approve the minutes. Do we have a second? We have a second. Any discussion? Seeing none, all those in favor of approving the minutes say aye. Aye. Opposed? The ayes have it. The minutes stand approved. Do we have anybody for public comments?
No, sir.
Thank you. Financials, Mr. Elam.
Yes, sir, Mr. Chairman. So, for the month of January in the 264 fund, revenue $1,860,406. Expenses $2,297,236. And your revenue less expenses, a negative $436,830. For the calendar year, those numbers will remain the same since it's just 1 month. And for your 24-25 fiscal year comparison, revenue you have $13,607,985. Expenditures $15,315,517. Revenue less expenditures a negative $1,707,533. In the 266 fund, for the month of January, you have $167.67 under workers' comp. Under OJI, you have $109,205.01. And under the year-to-date total for workers' comp, you have $6,054.61. For OJI, you have $641,130.94. And for the total is $647,185.55. And that concludes my report, Mr. Chairman.
Thank you, Mr. Elam. Any questions for Mr. Elam on the report? If not, we will entertain a motion to accept. We have a motion to approve. Do we have a second? We have a second. If there's no further discussion, Susan, call the roll, please.
Commissioner Boyd. Yes. Amber Brown. Yes. Mike Curtis.
Yes.
Holly Deering. Yes. Brian Gaither. Yes. Mary Hickerson. Yes. Lois Miller. Yes. Commissioner McAdoo. Yes. Commissioner Phillips. Yes. Jennifer Schmidt. Yes. Sonia Stevenson. Yes. Eric Tutobeni.
Yes. You did get that Ms. Deering was the second?
Yes.
Thank you. Susan, OSHA report, please, ma'am.
Yes, sir. For January, we had 10 incidences. Of those 10, the BOE had 6, Rutherford County General 4, Highway 0. Of the Rutherford County General, there was 3 at the Sheriff's and 1 at Solid Waste. Our year-to-date frequency is the same as it's for January. The OSHA recordables were 6. The lost day claims, there was 1. The restricted day claims, 4, and 1 other recordables. Our reserves for the month of January are $40,241. That's also the same for the year-to-date. Year-to-date paid is $1,508 with 2 claims closed. We currently have out of work 4 and 7 on restricted days, and that concludes my report.
Thank you. Any questions for Ms. Thompson on the OSHA report? Seeing none, the chair will entertain a motion to accept.
Move to accept as presented, sir.
We have a motion. Do we have a second? We have a second. Did you get the motion second?
Yes,
Any
sir.
further discussion? Seeing none, if there's no objection, all those in favor of accepting the OSHA report say aye. Aye. Opposed? The ayes have it. The report stands approved. Item number 6. Ms. Howell, wellness report, please, ma'am.
The total number of wellness points earned so far in the 24-25 point accumulation period is, by members, is a total of 1,066 points, and a total of 110 employees have met their 3-point wellness goal. That concludes my report.
Thank you. Any questions for Ms. Howell on the wellness report? Seeing none, if there is no objection, we will accept. Item 7, the wellness points proposal, please. Ms. Howell, you're recognized.
As we're making a transition for our next point accumulation period, moving away from the Motivate Me platform that we have been using through Cigna, beginning in October, we're looking at this as a chance to potentially make our wellness point structure a little more robust and take advantage of some of the available opportunities through the platform, My Benefits channel that we're looking to move to. So we wanted to present the committee with a couple of options. The first option one is just continuing our same point structure. So it's the one that we currently have, it's just scaled up by 100 points. Everything has the same relative value. You'd still just have to earn the 300 points. Everything is worth the relative amount that it is currently. So the second option begins to take advantage of some of the platform's benefits that we can have. It includes an elective tier as well as the essential tier, which contains all of the current healthy actions that earn wellness points. So the total number of points that you would earn is a little bit more than it is currently, but some of the points are scaled up accordingly in that essential tier. So instead of an annual physical being worth 200 points, it would be worth 300 points. So an employee would have to earn at least 300 points in that top tier, but they can earn all 500. They could also earn up to 200 points in that elective tier. So they can either earn points with a dental cleaning, an eye exam, and if an employee isn't on our Cigna dental or eye vision benefits, then they can self-certify those up to 1 per year. They would also have the opportunity to take advantage of the educational videos and articles that are built into the My Benefits channel platform, and they can earn points for those. They could earn all 200 points just by going through those educational materials. So we wanted to bring this option to the committee and ask the committee which direction they'd like us to go.
Ms. Brown, you're recognized.
Just a question on the point structure. Just curious what the team's process was to determine which screenings that you added that 100 points to, because some of the other screenings at the bottom that are still 100 are the same from the status quo. So just curious the process.
Yeah, so we scaled up the annual physical, the biometric screening, and then any cancer screenings as well.
And how? So the question is more of like, how did you determine to
Yes.
select those against the others?
Yes, so a couple of reasons, a couple of things we did is that instead of it being 3 points, and then if we went down to the bottom and it being a decimal, we just added zeros to those. And then to get to your question about, how did we get to the ones at the top, that's essential tier, that is no change from what we've done over the years. The bottom tier is just something that we added because there has been some talk about, dental cleaning, getting some kind of credit for that, for those that get it, annual eye exam, and those things are easier to, for someone to just upload an invoice or something and be able to get credit for that. It's real easy to confirm that they actually did it themselves. And then our goal is also is when you look at the bottom 25, My Benefits channel has a very large library, and we also can put things in that library that we could make it easier for people to look at videos and articles. And for someone to get the 200 points, and I, not to pick on Mary, but like her group, if they have somebody that says, well, I need some extra points. I need 100 more points. Their office, instead of just talking about something, they could actually take the video and get credit for it. Like in a department meeting, and then they would have an attendance sheet, and then they would be able to upload it on the attendance sheet, and send it out to my benefits channel to where all those points would be recorded. The other thing is we wanted to try to keep it right now as simple as possible, changing from one platform to the other. So it would be very easy for the employees to be able to maintain their points and understand the change from Cigna to the My Benefits channel platform. And then we can come back and look at it again, look at different ideas a year from now to make that change to see, do we want to tweak this? Do we want to add, take away what's working, what's not working? But the biggest thing is getting it transferred over from one to where this is Rutherford County's wellness plan, and it'll stay with Rutherford County, not as we change around maybe from one carrier to the other. This won't change.
Yes, Mike, you're recognized.
This is directed at either one of you. For the essential tier, these are all things that look very similar to what everybody's done already. It's like you said. How are these reported to us? Does the employee have to show proof of that, or will you be getting some other way through Cigna of showing that that has been done for that employee?
Yes, so right now we're looking at a possible file feed of information, and then we would push it towards My Benefits channel, and then you would go into My Benefits channel instead of My Cigna. Like some of the things we do, like with the wellness points, you can go into Cigna and looking for it, but if one of their requirements is like a physical, and then they're only with us like 3 months, we override Cigna's points because we give them credit for that physical, pre-employment physical, because it's as Mary will tell you, it's hard to get, when you take the annual physical out, it's hard to get these numbers at top if you leave that after you've already gotten a physical. So they would be able to go into My Benefits channel, and it should be more accurate as opposed to going into My Cigna, and you wouldn't see that physical as it didn't go through a claim.
Yeah, to follow up on that, the employee, if they say go to their doctor and they get a physical and a flu shot and say a biometric screening, the fact that they've done those things would show up in their Cigna claims.
Yes.
And do you get a report from Cigna on that?
Yes,
That's how you track where it goes in automatically? That way the employee doesn't have to come up with extra documentation that this is done?
But unlike the dental cleaning or maybe the annual eye exam, they would have to upload a form or an invoice or something, and then that would go into the My Benefits channel.
So what if they have dental and vision as part of their Cigna? Would that be reported automatically, or they still have to do that?
I think it would be automatic, but
Okay.
again, trying to get those details, we got that far on the
Okay,
details.
I'm digging too deep in the
But
weeds.
we
I
should-
apologize.
No. We should be able to get the file feed.
Madam Secretary, let the minutes reflect that Michael Smith has decided to join the committee. Thank you. Sonia, you're recognized.
I want to make sure that I understand. Are you saying that the system that we currently can go in and look at, so let me just start with that. We can go into mycigna.com and see how many points we've achieved. Are you saying that's going away, or are we, I guess that would be my question.
It would not show complete accuracy. You could probably still go in there and see it, but it would not show your full 500 points or everything, because if you're getting part of it from an eye exam, that wouldn't go through your MyCigna claims, or if you do the educational piece, it would not be in the MyCigna. But that's the same problem we have now, like with pre-employment physicals. It doesn't go into the MyCigna either, and so then people are calling us, hey, and we allow the departments that require that to send us a list, and then we override the system also. But those claims never show up under the MyCigna point system either.
So it'll still track the things that it tracks today. It's just these additional things that if we want those counted, we have to make sure we submit those.
Right.
And employees will be able to go in and see the points that they have earned through my benefits channel. So they will still have a way to go in and view points. Yeah.
And it should be more accurate, too, and up to date.
Mary, do you have a question?
Yes, sir. Couple, but we'll start with this. So what are we going to do with the people that have no way of uploading their dental and annual eye exam into the My Benefits channel? Because we already have to send employees to insurance, or they flat out don't log into My Segment to do their annual enrollment. So what are we going to do for those folks that don't have the means? I mean, they can take a Friday or anyway. So how are we going to get the folks that don't have the means to upload into the system the dental and eye cleaning? And I'm assuming the videos would be done online. Of course, understanding what we do kind of for my group, but so the videos are going to be online and moved, but how will the dental and eye exam be uploaded when they don't have access to computers to upload that?
So if an employee has access to email, they can email those to us and we'll be able to help them out with that step. If they don't, they can still stop by our office and we're more than happy to help them. So.
Okay, so then my next question, or actually statement, because I know I've brought this up before, how it is harder for the men, in my opinion, to get all of their 3 points. We'll start with 300, whichever way you want to talk about it. And so I had mentioned trying to do something with dental cleaning and annual eye exam, because a lot of mine, believe it or not, actually go to the dentist and they go get their eyes checked, believe it or not. So this plan too, with the having the electives and moving it up to the 500 points, I would be good with that. What I have trouble with is leaving the mandating that the first 300 points still has to come off of the initial point system that we've had for a long time, from day one, basically. So that's my problem with it, that we could only, those 300 points is still mandated, and we've not helped them in. We've only given them options to get from 300 to 500. We've not helped their options to get from 0 to the 300. And so, I mean, this looks all good, and it is good to change the format, that it would be the county's format, and so I get that. I just still have trouble and heartburn with the mandatory 300 points still have not helped the men, not many women too, but the men population that we hear a lot from at work, getting their first 300 points.
Well, again, it is an option, if you want to go this route. If you don't want to, you don't have to get any point. It's not like it's mandatory that you have to go this route. The upper tier, these are the ones that are the wellness where they are no cost to the employee. And the most effective part of our claims is to try to reduce claims and to also improve employees' health. That upper tier is very important. If you move those up there and they're allowed to avoid maybe a annual physical and blood screening done, then I don't know that the whole wellness plan is as effective.
Question. So what are we looking at today? I know we have to move because Cigna is fixing to do away with their motivate meeting. So we've got to move it. We're moving it to My Benefits. So what do we need to do today? Would it be better to move it and stick with the original 3/300 points that the guys have always been used to, and try to figure out a way to, if we move it to 500, to give more choices and not give more choices to get the first 300
Well, if you're asking, our recommendation or my recommendation is Plan 2. And then look at if we want to make a lot of additional changes, if we want to add points, take away points, or however, is to look at this and say, okay, over the next year, after we have moved and we've got our platform up and running and the people are used to it, and whatever changes we need to make, then we can do those at a later time. But I think at this point, for dental cleaning, annual exams, and some educational pieces, that's why we looked at, and that's what my recommendation is for Plan 2.
Any further questions or discussion? Miss Mary, are you ciphering over there?
Yes, sir.
I want to give you plenty of time, because I know you're processing, so.
No, I mean, it makes perfect sense, and the move makes good sense. What I have heard with is, it's still hard for my guys, and it's not just my guys, I call them my guys, but there are other people, to get that first 300 points. And I get it, and I understand it, and we do need to make the change, and then we can always change it again. But we need to really look at, and I realize the not cost to, because these are physical items or wellness items that are going to pay for it 100%, but I really think we need to look at a way, and dental annual eye exam and those videos are great, and the option of my guys, even me, I mean, I get mine 300 without, but those are good options, and the educational piece is a good option. I just hate that those 3 items are not up to help make up to the first 300. If we can count 2 of those to help get to the 300, and then everything else to get to the 500, they'd have to choose. But that's my only heartburn with any of them. It's not the items, it's because they're very, because dental, if you got a good healthy mouth, you're going to be pretty decent healthy, because you can, anyway, in an eye exam, I mean, we've had guys that have come in and they got glasses because they did their CDL physical. It's like, man, I didn't know how bad I could see. So, you know, those are things that they're going to get. And so I wish we could figure out how to put those 3 up to just make it the holiest up to 500 points.
Ms. Brown, would you want to speak, please?
I did, and it's going back to the points and trying to just understand. I know that we're going to roll this new platform out, but will the points roll over, or will the points be starting at 0?
The points will start at, if we roll it over before our new period of October 1, then these points would roll over, but it wouldn't be mandatory. We would stay with the old one, because those are already and have already been publicized. That's what you got to meet. So we're not adding anything to anybody.
Correct. And I do like the new plan, but the other thought I was just having is, if we are going to introduce the new plan and I've already taken my annual exam, do I then get the new extra 100 points? Like, I don't know if that would be a benefit or not. So that was where my...
Yeah, we begin this structure at the beginning of the new point accumulation period. So
Okay.
essentially, there would be a clean break between the current accumulation period and the new one.
Okay, thank you.
My apologies. We're trying to address what we think is an audio problem that has apparently cropped up in the last several meetings. Chairman Phillips, I don't know if you were aware of it one of the last committee meetings, but we're trying to address a technical issue. So my apologies, ladies and gentlemen. Yes, ma'am, you're right. I'm sorry.
Yeah, I'm looking at these, and I really like the differences that we're seeing here, and I like the additional values. while the 500 points may seem onerous, if you look at the values of these original things, they've been increased, so it's no more additional steps to get the 500 points as it was to get the 300. So now you've just got more options to add to it. So I think it's an excellent plan.
Well, and yes, Chairman Phillips, you're recognized. Thank you, Ms. Miller.
Just follow up with that. Mary, I hear what you're saying, but from a wellness perspective, people need to be doing these things. Look at the 500 points. You go get an annual physical, you go to the dentist, you get a flu shot, you got 500 points. That's not asking too much, I don't think. From a wellness perspective, I may be looking at it differently than you are, and you may be right, because every time I open my mouth, you're always right. And
There's a lesson in there, right?
I don't really see why it's that hard for your guys. You know, you want people to get a physical. You need to get a physical every year. You need to go to the dentist every year. You need to get your flu shot every year. 500 points. Pretty easy.
Miss Mary, absolutely.
Okay. Okay, can we hear me now? Okay. What I have to remind people of, and I get it, a lot of my guys in the office, and I'm not saying my men are different, but you've got men that are on tractors, dump trucks, backhoes, solid waste that are in those trucks and things like that. They don't, and I'm not dissing anybody, they don't sit at a desk every day. And when my guys work, they're 40 hours a week. There are 2 days that they have to choose a Friday or can't come see y'all on Sunday, but they choose a Friday. Well, that's taking away some extra money that they're making on the side to supplement. But it's, I know it is a mindset, and granted, everybody has a choice to not get any points. It just costs them extra month, extra money each month, which is fine, and it's their choice. But you have to realize that the county is not just made up of the folks that have the desk jobs or the teachers. You have people in patrol cars and fire trucks, and you've got people on tractors and backhoes and in the solid waste roll-off trucks and things like that. So I think to take care of our employees, we have to be mindful of not their abilities, their means of getting. And like I said, you can choose not to do any of this. And I have some that it doesn't matter how many points you laid out and handed them, they're still not going to do it. And they choose not to do this. But I just feel that we need to make it an option for all the employees, no matter what, where, or when they're employed or where they're employed at, that they are given a fair shot for their means. And, but I mean, I can get way over 500 points in the top for myself, and my husband's the same way. It's just not everybody has that mindset, but they may go for a dental cleaning and an eye exam. And I actually had a guy the other day that went for an eye exam as part of his CDL physical, and he had cataract surgery 2 weeks later. He's like, oh, well, I didn't know I couldn't see that bad. So, an eye exam caught that, and he's, probably in a month or so going to go get his other one done. So there are means that, and, he could really care less, knowing him, about the flu shot. But he now is going to go check his eyes, and he always goes to the dentist. So we just need to make sure that we give all of our employees, no matter their location or whatever, the means of being able to, if they want to save the money, be able to get the points.
Molly, let me ask you a question. The wellness points program or proposal that we're discussing, the purpose of the wellness points is to incentivize Rutherford County employees, and this is a question, but it's to incentivize Rutherford County employees to be proactive in regards to taking care of themselves, because study after study has shown that if you're proactive in getting a physical or getting the exam or having your teeth cleaned, that the cost associated with the results of not being proactive is greater than if you were proactive. Is that accurate? So there's an actual cost benefit to the county when our employees are getting physicals, eye exams, dental exams. Is that a true statement?
Yes, what we're looking at here is that we're trying to incentivize, as you say, preventive measures.
Correct.
So to have an employee look at their health.
So we're incentivizing preventive measures in an effort to keep costs down. Is that an accurate statement?
In addition to helping the employee personally and helping the department retain their employees.
Absolutely. So the question I have, and I guess this is directed at you a little bit, Mary, or anybody else, I'm trying to figure out if this is a good program. It may not be perfect, but are we going to let the perfect stand in the way of the good? And is this a program, Ed or Molly, that once we see in 3 to 6 months that we could tweak, would we be able to tweak it to improve it if we find that indeed it's not perfect, but it is good? And so how could we then tweak it going forward to make it better? Could we do that?
Yes, you do have to be careful because it'll be put into the guides for annual enrollment. So you don't want to set a set of standards and then change that standard midstream. Correct. So it would be for when the wellness points start over the next year.
Okay. Mr. Tudabini, you were recognized.
Yes, I have an observation and a suggestion. Looking at the 300 plan and the 500 plan, they seem to be relatively equal effort, not major difference. The 500 actually might be a little bit easier than the 300. However, to make things even more simplified, if you move the dental and the eye exam up into the essential tier and only have the videos in the elective tier, that may solve a lot of problems.
Mr. Smith, you're recognized.
Yes, I think there's some other options too that we haven't really looked at, that we could change the way we do wellness points altogether that would actually save the county some money. I could put pen to paper and show that sometimes this would cost us more money. I can prove that mathematically. But I would like to make a motion to defer this till next month, since it seems like there's a lot of confusion, and sometimes some people say it's better, some people say it's easier, and then that way we could come back and actually put pen to paper and say, does it save the county money, does it not? And look at some other options, because right now these points essentially just affect premiums for employees. But you could have other options where some plans, instead of it affecting premiums, it only affects how much you give HSA, or affects the deductible, or it affects the out-of-pocket maximum. And so that way it wouldn't penalize some people who maybe don't believe in getting a flu shot, or maybe don't have the option to upload some stuff. But I just think if we deferred it 1 month, that would give Mary a chance to go back and get feedback from her guys. And then we could study moving the dental and annual exam up into the essential tier. And then we'd have our answers on some of these questions if we deferred it 1 month. So I guess that would be my motion.
That is a proper motion. Do we have is that a second, Mr. McAdoo? I'm sorry? That is a second. Yes, sir. So now that we have a proper motion, a second, we will have discussion. You're recognized, Chairman McAdoo. Please use your mic. Thank you.
Thank you, Mr. Chairman. Not only looking at her employees, I think that maybe we should check with all employees, especially law enforcement, and get the feedback on what they think. If we're going to defer it for a month, let's get feedback from all our employees and bring the whole picture that we can look at instead of just pulling out one department. So if we're going to defer it, I think all employees should participate in their opinion.
Thank you, Chairman McAdoo. I have been asked by Ms. Thompson, and I think Emily Lambert, and she's the wellness coordinator, is kind of raising your hand. I think that's right, is it not right? Would you like to come up and address the committee? If there is no objection, we will go out of session and hear from Ms. Lambert. Come up, introduce yourself, and express to us your words of wisdom. Thank you.
Yes, my name is Emily Lambert. I'm the Wellbeing Coordinator for Rutherford County. I'm your Cigna representative. I just wanted to kind of put my 2 cents in with the preventative care and the points and why those were chosen, and just kind of, support their decision with that. I think eye exams and dental exams are, of course, incredibly important, and as adults, we're a lot more likely to get an eye exam or a dental exam than a physical. When we're children, it's very normal to have a physical, and we want to encourage our employees, these adults, to get physicals, because like you said, your employee went to an eye exam, they had to get cataract surgery. Imagine if they haven't seen their primary care provider in 10 years and they find out they have heart disease. And that can move mountains for them. So that's why it's looked at as such a big point structure in terms of something that we're just sort of kind of used to doing, the eye exams, the dental exams. You schedule those every 6 months when you're there. It's just not as, we're not taking the actions to do our physicals as much as we should, and that's why it's such an important thing for that to kind of be the gatekeeper, because a physical and a biometric screening, those can save lives in so many ways. And if I just want to put this out to everyone, sorry, I'm turned sideways, but if your departments kind of struggle to see why is it important for me to get biometric screenings done, or why should I go see my primary care provider, that's what I'm here for. If you need some education for your groups on preventive care, on why you should get your physical, how you should go about that manner, please reach out to me. I'm happy to, come speak to your team and just provide, some simple education on, it's not that hard to get your physical. We just call them like we call our dentists, and this is the importance of it and why we should do it. So I just want to put my 2 cents in there, just some food for thought to bring to your departments if this is going to be a conversation that you guys are going to have and come back with, and just support their decisions of why they've chosen the point structure that way.
Any questions for Ms. Lambert? Seeing none, thank you, Ms. Lambert, and we'll go back in session.
Thank you.
So currently, we have a proper motion and a proper second to defer 1 month. Do we have any further discussion? If there is no discussion, we will call a roll call vote to defer 1 month. Please call the roll.
Commissioner Boyd? Yes. Amber Brown? No. Mike Curtis? No. Holly Deering? Yes. Brian Gaither? Yes. Mary Hickerson? Yes. Lois Miller? Yes. Commissioner McAdoo? Yes. Commissioner Phillips? Yes. Jennifer Schmidt? Yes. Michael Smith? Yes. Eric Tutobeni? Yes. Oh, Sonia Stevenson. Yes. Sorry, I skipped over you.
Showing the love. Motion carries. We will defer this for 1 month. Mr. Smith, if you can provide some financial data referencing the idea that there may be other options financially more suitable to the county, so we can consider those if that's okay. Thank you. We are now to item 8, the Kroger Sea Farming update. Mr. Huffman, you will come and you are recognized. Thank you, sir.
Thank you, Mr. Chairman. So Paul Huffman with Cigna Healthcare. Just want to give you a quick update. At the end of January, we, Cigna and our Express Scripts Pharmacy, reached an agreement with Kroger to bring them back into our commercial network. However, that means we are still evaluating the cost of what bringing them back into our commercial network entails, especially with as it relates to GLP-1 medications and the reimbursements we have for that. So more to come on when Kroger will be back in the commercial network, but the good news is that we are headed toward that finalization. The other good news is that effective immediately after that signing of that agreement, Kroger was added back into the Medicare Advantage network. So those individuals that are on the Medicare Advantage PPO product automatically now have the ability to go back to Kroger as of February 5th to use them as in-network. So we've committed that more information will come as we decide how we are going to bring Kroger back into our commercial networks, and that has not yet been determined. So more to come, but since many people had seen that announcement out there, I wanted to clarify and see if there were any questions.
Thank you, Mr. Huffman. Any questions for Mr. Huffman? Yes, Mr. Curtis, you're recognized.
Just a slight comment. It's about 2 years too late for a lot of people. Just a comment from the people that I work with that had to change pharmacies because they were there, and they will probably never go back because of that.
Yes, we're aware it caused a lot of disruption. We have always been willing to come to the table to negotiate an agreement with them, and we're just thankful that we finally have.
Any further questions or comments? Thank you, Mr. Huffman.
Thank you.
My apologies. Sonia, did you have, we're going to have to move you over or something. So.
I don't think this works. The only thing I was going to say is Kroger's must be excited about it because they've already started calling their retirees and saying, hey, you can come back in February.
Good.
So
Okay.
my mother had actually asked me, and I was like, I haven't heard that yet. She knew before I knew. So.
Yeah, we know that will probably cause some confusion because them being in the network already for Medicare Advantage, but not yet for the commercial, people are going to ask that question and be confused. So we're working toward that resolution, and once we have those decision points to bring to your staff, we will.
Thank you, Mr. Huffman.
Thank you.
Last item, other business. Is there any other business before the committee? Seeing none, our next meeting is March 27th. We stand adjourned.